Welcome, medical students, to today's lecture on gastroenterology. In this comprehensive script, we will explore the intricate world of gastrointestinal motility abnormalities in amyloid deposition, along with various other aspects of amyloidosis affecting the GI tract. Without further ado, let's dive into the fascinating realm of gastroenterology. Amyloid deposition in the GI tract can disrupt normal functionality, causing motility abnormalities. Amyloid fibrils infiltrate smooth muscle cells and nerves, compromising muscular contractions and leading to dysphagia, dyspepsia, altered bowel habits, malabsorption, and bacterial overgrowth. Studying these mechanisms is important for treatment development. When examining stomach biopsy samples, characteristic histopathological features can aid in the diagnosis of amyloidosis. These features include the deposition of eosinophilic, amorphous material in the lamina propria, submucosa, and blood vessel walls. The amyloid fibrils can be further characterized on immunohistochemistry, revealing the type of amyloid protein involved. Differentiating between primary and secondary forms of gastric amyloidosis is essential, as primary amyloidosis often requires systemic treatment, while secondary amyloidosis focuses on addressing the underlying cause. During endoscopy, specific signs of duodenal amyloidosis, like nodules, fragility, or thickening, can be observed. Biopsies may confirm amyloid deposition. However, distinguishing it from similar conditions like celiac disease or lymphoma can be challenging. Advanced techniques like confocal laser endomicroscopy or endoscopic ultrasound can help improve accuracy. Gastrointestinal bleeding is a common complication of amyloidosis, and effectively managing it is crucial to prevent potentially life-threatening consequences. The management of GI bleeding in amyloidosis involves a multidisciplinary approach, including endoscopic interventions, pharmacological therapies, and, in severe cases, surgical options. Endoscopic techniques, such as injection sclerotherapy, thermal coagulation, and clipping, are often employed to achieve hemostasis. Novel therapies, such as targeted antifibril therapies and emerging endoscopic techniques, are being investigated to improve outcomes in patients with amyloid-related gastrointestinal bleeding. The clinical presentation of gastrointestinal amyloidosis can sometimes mimic that of inflammatory bowel disease, IBD, leading to diagnostic challenges and management dilemmas. Both conditions may present with abdominal pain, diarrhea, and weight loss. However, certain clinical clues can help differentiate the two, such as the age of onset, extraintestinal manifestations, endoscopic findings, and response to treatment. Utilizing a combination of clinical, endoscopic, histological, and radiological assessments is crucial in accurately diagnosing and managing patients with gastrointestinal amyloidosis, especially in those with overlapping features of IBD. Surgery may be needed for localized gastrointestinal amyloidosis for diagnosis and treatment. It can relieve symptoms, prevent complications, and obtain tissue diagnosis. Individualized surgical approaches should consider disease extent, other amyloidosis involvement, and overall health. Long-term follow-up is important for monitoring and assessing outcomes. Cutaneous manifestations can provide important clinical clues for early diagnosis and management of gastrointestinal amyloidosis. Skin involvement in amyloidosis often presents as purpura, petechiae, or ecchymosis. Sometimes, the skin lesions can be the first clinical sign, prompting further investigations to identify the underlying systemic amyloidosis. Recognition of cutaneous signs is crucial as it can help initiate timely diagnostic workup and therapeutic interventions. Additionally, managing skin manifestations can improve the patient's quality of life and overall well-being. Hepatobiliary involvement is commonly observed in patients with gastrointestinal amyloidosis and can significantly impact disease prognosis. The deposition of amyloid fibrils in the liver and biliary tract can lead to hepatomegaly, jaundice, hepatobiliary dysfunction, and cholestasis. Understanding the pathogenesis of amyloid-associated hepatobiliary disease is crucial for identifying therapeutic targets. Currently, there are limited treatment options, focusing on controlling symptoms and addressing complications. Ongoing research aims to develop disease-modifying therapies that target hepatic amyloid deposits and improve overall outcomes in patients with amyloid-associated hepatobiliary disease. Radiological imaging is crucial in evaluating gastrointestinal amyloidosis. Computed tomography, CT, magnetic resonance imaging, MRI, and nuclear medicine scans aid in identifying amyloid deposits and assessing disease extent. Each modality provides unique information for accurate diagnosis and monitoring. Gastrointestinal autonomic neuropathy and amyloidosis affects patients' quality of life by causing symptoms like dysphagia, gastroparesis, diarrhea, and fecal incontinence. The disruption of autonomic nerve function leads to smooth muscle dysfunction in the GI tract. Treatment strategies aim to control symptoms through dietary modifications, prokinetic agents, and novel therapies targeting autonomic dysfunction. Gastrointestinal amyloidosis can significantly impact a patient's nutritional status, leading to malnutrition and weight loss. Defective absorption, increased appetite, dysphagia, and altered metabolism contribute to this nutritional impairment. Accurate assessment of nutritional status is crucial in guiding appropriate management strategies. Nutritional interventions in patients with gastrointestinal amyloidosis focus on optimizing calorie and protein intake, addressing micronutrient deficiencies, and managing specific symptoms contributing to malnutrition. Multidisciplinary collaboration involving dietitians, gastroenterologists, and specialized nutritional support teams is essential in providing comprehensive care to these individuals. Genetic mutations have a significant impact on the development and progression of gastrointestinal amyloidosis. Understanding their influence on the disease's characteristics is vital for managing it effectively. Several gene mutations, like transthyretin and apolipoprotein A1, have been linked to gastrointestinal amyloidosis. Studying the molecular mechanisms behind these mutations can lead to targeted therapies. Ongoing research aims to discover new genetic mutations and their role in the disease, which can improve diagnosis and treatment. Gastrointestinal amyloidosis is a complex condition that requires a comprehensive understanding of its mechanisms, clinical manifestations, and management strategies. Continued research and collaboration are critical for improving patient outcomes. Thank you for your attention and interest in gastroenterology.